What is hypothermia? And hypothermia treatment. Hypothermia is a potentially dangerous drop in body temperature, usually caused by prolonged exposure to cold temperatures. The risk of cold exposure increases as the winter months arrive. But if you are exposed to cold temperatures on a spring hike or capsized on a summer sail, you can also be at risk of hypothermia. Normal body temperature averages 98.6 degrees. With hypothermia, core temperature drops below 95 degrees. In severe hypothermia, core body temperature can drop to 82 degrees or lower. What causes hypothermia? Possible causes of hypothermia include cold exposure. When the balance between the body's heat production and heat loss tips toward heat loss for a prolonged period, hypothermia can occur. Accidental hypothermia usually happens after cold temperature exposure without enough warm, dry clothing for protection. Mountain climbers on Mount Everest avoid hypothermia by wearing specialized, high-tech gear designed for that windy, icy environment. However, much milder environments can also lead to hypothermia, depending on a person's age, body mass, body fat, overall health, and length of time exposed to cold temperatures. A frail, older adult in a 60-degree house after a power outage can develop mild hypothermia overnight. Infants and babies sleeping in cold bedrooms are also at risk. Other causes. Certain medical conditions such as diabetes and thyroid conditions, some medications, severe trauma, or using drugs or alcohol all increase the risk of hypothermia. How does cold exposure cause hypothermia? During exposure to cold temperatures, most heat loss up to 90% escapes through your skin. The rest, you exhale from your lungs. Heat loss through the skin happens primarily through radiation and speeds up when skin is exposed to wind or moisture. If cold exposure is due to being immersed in cold water, heat loss can occur 25 times faster than it would if exposed to the same air temperature. The hypothalamus, the brain's temperature control center, works to raise body temperature by triggering processes that heat and cool the body. During cold temperature exposure, shivering is a protective response to produce heat through muscle activity. In another heat-preserving response called vasoconstriction, blood vessels temporarily narrow. Normally, the activity of the heart and life-threatening condition that needs emergency medical attention. If medical care isn't immediately available, remove any wet clothes, hats, gloves, shoes, and socks. Protect the person against wind, drafts, and further heat loss with warm, dry clothes and blankets. Move gently to a warm, dry shelter as soon as possible. Begin warming the person with extra clothing. Use warm blankets. Other helpful items for warming are an electric blanket to the torso area and hot packs and heating pad on the torso, armpits, neck, and groin. However, these can cause burns to the skin. Use your own body heat if nothing else is available. Take the person's temperature if a thermometer is available. Offer warm liquids, but avoid alcohol and caffeine, which speed up heat loss. Don't try to give fluids to an unconscious person. If the hypothermic person is